Good afternoon or good morning still to you all, and thank you for joining us for our Advocates panel. My name is Lauren Rizzo, and I am the Vice President of Client Engagement at PPL. Hope you all are finding today's sessions helpful, engaging, very useful in navigating some of the many programs in New Jersey. As many of you probably know, July is Disability Pride Month, and I am honored to moderate this advocates panel and bring you this important information on advocacy best practices and available resources here in New Jersey for the differently abled community as well as the aging community. In this session, you'll hear from two advocacy agencies, Autism New Jersey and the ARC of New Jersey. They will share more about each of their agencies, including the services and supports they offer. Throughout the session, we do encourage you to ask questions in our chat, and we will try to address as many of your questions as we can. Now, let's introduce the speakers. First, we have Lisa Ford. She is the director of the ARC of New Jersey Family Institute. I had the honor of attending and celebrating the ARC of New Jersey's 75th anniversary of advocacy and services to New Jersey families and stakeholders with Lisa recently, and congratulate her and the ARC on this amazing milestone. Next, we have Jon Gottlieb, who is the Director of Information Services for Autism New Jersey. Jon has worked for years supporting families in navigating and connecting to the support system networks here in New Jersey. The Autism of New Jersey 42nd Annual Conference will be coming up here in October and is another way to connect with others in this community of families and advocates. Thank you both for being here today. Jon, we're going to kick it over to you to start off with a little bit around the mission of your agency and the types of services and supports that you offer.
Sure thing. Thanks very much. And you can go on to the next slide to start us off. Oh, I think we skipped ahead 2 slides. There we go. So my name is Jon Gottlieb. Like Lauren said, I'm the Director of Information Services here at Autism New Jersey. Autism New Jersey is a nonprofit organization that informs, engages, and connects people with autism, their families, professionals, and policymakers. We provide service navigation, clinical and public policy expertise, and statewide initiatives to ensure people with autism can be safe, healthy, and happy. Before joining Autism New Jersey about 3.5 years ago, I ran a special education law firm. So I'm trained as a lawyer. I'm not barred in New Jersey, but instead what I do is I'm still barred in New York, and I use that legal acumen to do a lot of the work that I do as head of our 804 Autism helpline. So you'll learn a little bit more about that in my presentation, but we can go on to the next slide if we'd like. And here you'll see Autism New Jersey's service pillars. You can think of them like our 4 major departments, and you can also think of them like an informal agenda for today's talk. So I'll go through each of the different departments, what they do, the programs that we offer, and the programming that we do in connection with them. And we'll go through them kind of one by one to explore them. The 4 different departments we have are, as you can see up on your screen, Information Services, Clinical Expertise, Public Policy, and Awareness. So let's go ahead and talk about Information Services first. Next slide, please. Information Services has the 804 Autism helpline as our flagship service. That is both a phone number, 804 Autism, and an email address, information@autismnj.org, that exists to answer any question about autism from birth to end of life. We get thousands of calls each year, and they can range from simple, so that's something like a referral that somebody needs for an ABA therapy provider agency, or maybe a special needs haircut organization, or it really can be anything. We have a lot of different referrals that we can give out to something much more complex. That can be, let's say, the family member of an individual with autism who may be 16 years old, who is presenting with severe challenging behavior. Maybe they're exhibiting increased aggression. Maybe they're engaging in self-injurious behavior. The family wants to know about what types of treatments might be effective, how to get connected with the right people in the different service provider agencies, whether that's the children's system of care, insurance-funded services, Maybe they're calling 911. They need some advice around how to navigate kind of the crisis response system in New Jersey. Maybe they're going in and out of the hospital. They have that sort of revolving door phenomenon that they're encountering, and they want to really figure out how do they address all of these needs in their life. So we address every inquiry that comes into that helpline. And the way to think about it is there's no question too big, there's no question too small, really anything for anybody with autism at any age. We take a lot of those frequently asked questions that we get on our 804 Autism helpline to enrich a lot of the different things that we do at Autism New Jersey. So some of the frequently asked questions we turn into articles or publications that we make available for free on our website. And I'll make sure to provide some of those to Lauren after this presentation that she can send out to maybe some of the attendees of today's talk. We also maintain a really robust referral database that supplements a lot of the work that we do on the 804 Autism helpline. That's something that's available both to our information services coordinators when they're on the call, but also we make it available to the public on our website. If you go to our website, there's a find a referral button at the top, and you can explore the more than 1,000 different service providers. We've got lawyers, financial planners, treatment advisors, special needs registries. Really, as long as we find that people are calling about a specific need, we do our best to both solicit recommendations for service providers in the community and make those available, and find out the providers who are high quality that we can enlist to pose as referrals for the 804 Autism helpline. Moving on to the next service pillar, a lot of the work that we do on, go back one slide, please. A lot of the work that we do in information services is enriched by our clinical expertise. So in addition to the service navigation expertise that we have on the helpline, we get a lot of feedback from our clinical colleagues. So we have decades of experience across our different clinical staff that really allows us to work with both service providers and families statewide to support the autism community in New Jersey. One of the things that my clinical colleagues do is put on, like Lauren said, our annual conference, which is in its 42nd year. This year, it's going to be 1024 and 1025 at Harrah's Casino in Atlantic City. And there is content for both providers and parents there. So there's going to be two days filled with more than 60 workshops, and registration is now available on our website. If any of the attendees are autism service providers, we also make CEUs available for a lot of those programs. One of the other things that lives within our clinical expertise department is our new family wellness program. So we acknowledge the needs of family members taking care of and living with an individual with autism. And the focus of this program is really to provide practical and holistic supports for parents, siblings, extended family, and other caregivers. One of the things that we're doing within family wellness is piloting our health and wellness coaching program. We've recently hired a director of family wellness who offers a small group health and wellness coaching that helps caregivers focus on their own needs and develop plans for incorporating some small steps to focus on their health and on their wellness so they can continue to support their loved ones while also caring for themselves. So if you or any caregivers that you know might be interested in kind of exploring one of these coaching groups, we also have the coaching sign up tab that's underneath the clinical expertise. So I'll make sure to kind of point that out when I send the materials over to Lauren. Later, what we're going to do within family wellness is to create more and more programs and resources to promote family wellness. And those are going to be announced later as this program really takes flight. We can switch the slides now, please. Next up is a public policy department or service pillar. We are a relatively small agency, so we just hired our 18th employee. And as a result, we recognize that although we are statewide, we really try to have a huge impact. we also recognize that we want to make the most change in the places where we can go the furthest. And as a result, we've had to make some choices around what our public policy agenda is so that we can make the kind of most profound changes. The elements of our public policy agenda are number one, funding. So increasing the availability of funding of services for autism. Two, workforce development. So we want to make sure we work hard to ensure a strong and qualified workforce, which included spearheading the effort to get a licensure law for behavior analysts passed, and join the coalition for a DSP living wage. And finally, we want to address the service gap that exists for children and adults exhibiting severe challenging behavior. So in that way, a lot of the work that we do on our 804 Autism helpline helps inform what our public policy efforts are. So a way to think about it is we work kind of on an individual basis within our 804 Autism helpline, and then on a systemic basis within our public policy service pillar. And finally, the fourth service pillar is our awareness program. Our ambassador program within the awareness service pillar is really the cornerstone of our awareness and acceptance efforts. That's something that has more than 1,000 participants every year that is across school districts, autistic individuals themselves, local businesses, family, and friends. Really, the ambassador program provides a platform that people can use to share personal stories and information about autism within their communities. Anyone can sign up to be an ambassador to receive materials and promote autism acceptance within their community. Another thing that we do as part of our awareness efforts, and because Autism New Jersey has been a trusted resource for the autism community for many years, is we also fulfill various requests for media outlets when they're looking for reliable information about autism and related topics. Next slide, please. And finally, here we have a few agency-wide initiatives that we've recently launched that touch each and every one of these service pillars. First, is our healthcare initiative, which really grew out of the COVID-19 pandemic. We were approached in 2020 by the Visiting Nurses Association of Central Jersey to put on a vaccine clinic for individuals with special needs that weren't able to get the COVID-19 vaccine in any other way, just because of their behavioral presentation. We were able to get hundreds of people the COVID-19 vaccine that wouldn't have been able to get it in any other setting. We're really proud of that. But one of the things that we kind of took away from it, one of the things it taught us, is that people with autism need more healthcare and get less. So out of that, we kind of launched our healthcare initiative. It's a way that we're trying to engage with healthcare providers to find these pockets of excellence, find people who are really serving the autism community when it comes to delivering high quality healthcare, and make that kind of the industry standard across the state. There are three main prongs of this healthcare initiative, which are the timely diagnosis project, making sure that people who want access to diagnostic services for autism can get it in a timely manner. We want to improve emergency department experiences for individuals with autism who need to go into hospitals. And finally, like I said, we want to take those autism-friendly practices and make those high watermarks really the baseline for all healthcare across the state. And in a similar way, the work that we did in our healthcare initiative informs our new law enforcement initiative. So as kind of the needs of the community grew and presented themselves to us in other ways, we learned that people with autism are reported to be 7 times more likely to have police encounters with than their neurotypical peers. As a result, we formed our law enforcement initiative, where we're working with stakeholders both in the autism and in the law enforcement community. This is a multi-phase project. Right now, we're in phase 1, where we've created a law enforcement advisory committee. We're holding a leadership roundtable, and we're relationship building with specific police departments. And in the future, what we aim to do is establish autism-friendly practices and disseminate those practices statewide. Feel free to go on to the next slide. That brings my part of the presentation to a close, but I'm going to make sure that these slides go out to everybody afterwards. It's got both my contact information and the information for our 804 Autism helpline So really, there is no question that's too big or too small for our helpline. Feel free to reach out to me directly with any questions that you may have, either about the work that I do in information services or the work that any of my colleagues do in any of the other departments. And thank you for the time.
Jon, thank you so much. A ton of great information. I heard a lot about referrals and sources of registries being very important to connect, resources and people together. FAQs are clearly very critical as well, so that folks know how to navigate all of these systems and advocate for themselves and their loved ones. And then, of course, leveraging technology and data and what we can do to get information and data out to more folks. So thank you so much for that. And with that, Lisa, I'm going to turn it over to you.
Thanks, Lauren. And I do want to mention, I'm listening to Jon, and one of the things that, and maybe he mentioned it and I missed it. There's a referral page that they have where families can go, and if they're looking for example, maybe a doctor that they're looking for in their county, they'll be able to pull it up there. So their referral page is great. I give out their information all the time when I'm talking to families. So it was great to hear Jon.
Thank you, Lisa.
So my name is Lisa Ford. I'm the Senior Director of the Family Institute. And that's what we're basically going to talk about today, the Family Institute, because honestly, anytime we get a phone call in the office and it's a family or the word family is sent out in the phone call, they send it over to me and then I'll send it over to what program it needs to go to. But I will mention to you that we do have a few programs, several programs at the ARC. One of them is our healthcare advocacy program, where we help with questions around Medicaid and Social Security. We have our public policy program, Project Hire, which is our supported employment program. We have our planning for adult life program, which is where I started back in 2013. I did a year with that program, so it's close to my heart, and it's all around school transition. That's the focus. We have our Camp JC, which is a residential camp in Effort, PA. Families can attend that camp a week, 8 weeks, whatever they're looking for, and that can be funded through the Division of Developmental Disabilities or Perform Care. We have our criminal justice advocacy program, and that helps individuals with IDD stay out of the criminal system. We have our self-advocacy project, and that's a program for individuals who are looking to advocate for themselves, whether that be down at the State House or helping their peers navigate the system. So that was just a few of the programs that we have at the ARC, but we're going to talk about the Family Institute. And my elevator speech for the Family Institute is that we've become the go-to place for families who are looking for support or help to navigate through the system. We help individuals birth all the way to adults. Next slide. So some of the things that you can find at our program, and one of the things that I always tell families, so when I'm talking to families and they say, oh yeah, we're all registered with the ARC of New Jersey, and that's great, but we have our own actually separate website, the Family Institute, and we have our own newsletter. So if you're signed up to get information from the ARC of New Jersey, make sure that you're also getting information from the Family Institute. And if you go to our website, you'll be able to look and see if you can sign up there. And we have email updates about important issues. We do action alerts for upcoming legislation. We have fact sheets, go bags, different ways in which to reach families. Navigation at a clip. So if someone maybe doesn't necessarily want to go and download a fact sheet or take a look at a fact sheet, they can download a video or a podcast that will help them learn a little bit more about a particular topic. We have our monthly e-newsletter that I really would love for you to go to our website again and sign up for that. We try not to bombard you with emails, but one of the emails that we do send out is our e-newsletter, and it gives you a bunch of information about what we're doing at the ARC and some of the things that the Family Institute is putting out. So please go over and check that out. And then we do resource and referrals. So we'll do individual advocacy, systems advocacy, really anything that a family needs to navigate through the system, we try to help with that. Individuals and systems advocacy. So we're looking to look for trends, listen to families who are saying this is an issue we're having problems here, and then we'll take that to the next level, we'll take that to our public policy program and let them know this is what the families are saying that they need. Through engagement, we engage through Facebook, Twitter, and Instagram. And then we do several resource fairs a year. We also reach out to families through our webinars, podcasts, workshops, and presentations. And we also do college tours of the different programs here in New Jersey that offer extra support and help for people with intellectual and developmental disabilities. Next slide, Lauren. Okay, so our newsletter, like I said, you definitely want to go and sign up for it because we share our monthly governmental affairs update. We share information about education. We have a whole section about Kids Corner where there's different agencies that a family might be able to utilize for their loved ones. And then we highlight what the chapters are doing. And so we're the state ARC, and then there's 20 different chapters of the ARC in every county. And you definitely want to connect to your local chapter because they do the bulk of the services and supports. But what we try to do in our newsletter is just give you, just highlight some of the things that they're doing every month. So please go over to the Family Institute because yes, the ARC of New Jersey has its own website, but the Family Institute does as well. And if you go there, you'll be able to take a look at past family, the Family Advocates, past webinars and anything that we do, we make sure to archive it on our website. So if you're looking for an old newsletter, you'd be able to find it there. Next slide. Okay, so, and what makes our website so special, and this was something that, as a parent, I understand how difficult it can be to navigate all these different systems, all these different agencies. And so we looked at it as we wanted to just make sure that it was user-friendly, that families can go and find exactly what they were looking for. Like I said, we archive everything. So anything that you might need, it's there. We're archiving it. If we did a webinar, like I said, a podcast, it's up there on our website. We go through it monthly to make sure that all the information is up to date. Like I said, we have many different learning tools. If you're more comfortable downloading a 15-minute podcast, you can do that. If you wanted to watch a webinar on your own time, you can do that. And then, just some other things that we have on our website to just make it, again, user-friendly. So go over and take a look at that. And it was okay, Lauren, and just look through it and let me. I'm always open to hearing families maybe different ideas on things that maybe we don't have there. So please reach out. Okay, next slide. Our go bags. We have lots of different go bags. So years ago, I was sitting at my my son's hockey game, and I was like, I need something to put on our, and this is when I first started at the Family Institute. I was like, I need something, some sort of place where I can put all the information about a particular topic. And that's how those go bags started. And so we have, and we update them as much as we can to make sure that all the links work and all the information is up to date. And so the topics that we have there range from ABLE accounts and what that is and what that looks like. So, and again, if we've done a webinar or a fact sheet, they'll be in that go bag too. And we want transportation. And I just did a presentation on self-direction myself, and it's up on our website archived, but we're looking to create a fact sheet for that as well. So take a look at our go bags. If you're looking for something about DVRS, or if you're looking for something about guardianship and alternative options, go to our go bags and you'll get the information there. Next slide, Lauren. We also put together our county roadmaps. So another thing, so we're always answering questions from families and professionals. And what we did was we created a roadmap for each county. And on there, we talk about the Family Institute, who you want to reach out to at your local chapter. We have our healthcare advocacy information, and then that's for all ages. And then over 18, where you're going to go, under 21, where you're going to go, and over 21, where you're going to go. So if you are looking for, a quick one pager about who you might need to reach out to, you can go over and download our county roadmaps. Next slide. Our fireside chats. So this was something that I started during COVID. So I had to figure out different ways in which to reach families, and so we created these little chats that we do with different agencies, again with different professionals that have information that we think families need to hear. And we've archived all of them. We have a little fireplace going when we're talking. It's like a Zoom platform that we do this on. And we have a series with the ombudsmans here in New Jersey. We did one with Planning for Adult Life, with our healthcare advocacy program, Division of Disability Services, Plan New Jersey, and the Catastrophic Illness and Children Relief Fund. And we're looking to do one in September with the ADRCs. So go over, take a look at them. They're great. They're quick. They're about 30, 35 minutes where we ask the professionals and the agencies about 5 to 7 questions about what they do and how they can help families. So go over and take a look at those. And again, you can go to the next slide. And I'm just highlighting things that I think can be very helpful for families. But if you go over to our website, we have so much more. So one of the other things that we created in the last year or two are the FI calendars. So families are looking for tips or topics or things that they're interested in, but they don't know where to go. And so what we've done is that every month we put out a calendar all about different resources, different places to go for that particular program. So from summertime resources to driving training resources, and you can go over there and take a look at all those because they're archived. Okay, next slide. My binder, another great tool. Families don't know what to put in their binder or their folder that they have at home for their families. We have a list to tell you what to put in the binder from DDD documents to SSI documents. So take a look at that. Quick notes. Again, we get calls from families and they're like, we're having trouble with DDD, or we're having trouble with perform care, or we need some help or support. We have a quick note for that. So when we're talking to families, it's great to have that information in front of you. So we have a one-pager for those. Take a look at those. I added this because we have a family advisory committee. We'd love to hear from new members or get new members involved. So if you're interested in becoming part of our family advisory committee team, reach out to me. I'm hoping that Lauren will share these slides with you and you'll be able to see that. We have a children's advocacy program, which is wonderful. And Adara is our director of children's advocacy, and she can help with early intervention to special education. She can attend meetings with you if needed, and she can also create an outline or something that you might need to take with you to your next IEP meeting. And you can request the advocate. So there's a form on the ARC of New Jersey's website, as well as the Family Institute, if you were looking to request an advocate for help or support when attending your child's IEP. And then another thing we're looking for, we have this wonderful grant where we're getting Medicaid stories from families who can tell us if Medicaid's working great for them, or if maybe it's not, they can share that with us. Okay, and then one of the other things that I did, so, and I don't know if anybody knows about the supports program manual and the community care program manual, but in there it tells you all about the different DDD funded services. But that manual is really big. It's like 200 pages, I think, or maybe even more. And so what we did was we pulled out all the DDD funded services available, and we created a fact sheet for each one of those. So if you go to our website, you'll be able to take a look at that. There we go. I saw that I was running out of time. So Lauren, I moved as quickly as I could.
Lisa, that was an amazing amount of information sharing in a very condensed amount of time. So very much appreciate you and all of that information. So many great resources. We will absolutely share out all the content from today
Great.
I hope it's helpful to everybody to have all of these different links and resources. I know I've learned a lot, so I appreciate you both and for sharing with us today. Now we're going to take a quick break and regroup at 12:15 Eastern for our next session, where Catherine Murray from Applied Self-Direction is going to take us through a discussion on the rise of self-direction and its future. Again, thank you, John and Lisa, so much for your time. We appreciate you, and we will talk to you all soon.
Great, thank you.
Thank you.